This is the weekly Health Law News Nugget from Southern Health Lawyers. I'm Rich Sanders.
And this is the News Nugget for Tuesday, June 12, 2018. Well, the Patient Protection and Affordable Care Act of 2010 was back in the news last week as the Trump administration filed a brief in federal court that undermined one of the key provisions of the PPACA. As most of the News Nugget watchers know, when a lawsuit takes place in court, regardless of system or jurisdiction, there's always a plaintiff, there's always a defendant, and there's always a court or jurisdiction. In this case, the plaintiff is a group of 20 states led by the state of Texas. The defendant is the United States, specifically the Department of Health and Human Services, and the jurisdiction is federal court in North Texas, specifically in Fort Worth. Well, last week, this lawsuit that had been filed by the state of Texas challenging the constitutionality of the PPACA, and which has been going on for several years, but kind of languishing in the procedural aspects of federal litigation, gained a lot of notoriety and was written up in the Wall Street Journal, Washington Post, and had a lot of news coverage on Thursday, because unlike the Obama administration, which had opposed the 20 states and filed repetitively motions and briefs to try and get the case dismissed, the Trump administration and this Department of Justice filed a brief basically that said we agree in many respects with the lawsuit filed by these 20 state plaintiffs, and in particular think that the provision of the PPACA, which protects individual Americans for getting health insurance without a pre-existing condition being used to deny them that insurance, that in particular is unconstitutional. And the Department of Justice would not oppose a ruling from the judge that the pre-existing condition part of the PPACA should be determined to be unconstitutional. As you might imagine, this was very controversial. Democrats and proponents of health reform rallied almost immediately all over the nation to support the protection of this particular part of the PPACA. It also is important for politicians to recognize that this is one of the most popular aspects of the health reform law. In poll after poll, survey after survey, Americans like not having pre-existing conditions being used to preclude them from getting health insurance. The Kaiser Family Foundation had a couple of statements on this last week, as well as other sources of information. I've seen estimates go from anywhere from 20 to 52 million people who have health insurance as a result of not having pre-existing conditions being considered as part of their underwriting process. The truth is probably somewhere in between. What's important to take away after this news nugget, though, is that healthcare reform and the attempts to repeal it, although they were unsuccessful in the legislative arena, are now moving over to federal court. So stay tuned. There's likely going to be an appeal and continuing federal litigation over this particular issue on this controversial law. Thanks a lot for your joining us this week. Have a great week, and we'll see you next time. I'm Rich Sanders with Southern Health Lawyers.